Today we're going to talk about why it is extremely important to be careful when working the anterior neck and the damage that you can do to someone if you do not. So here are the cardiovascular structures in the anterior neck. This is your SCM muscle running right here, right? And a lot of people will preach that you can like yank this thing and like pull it out. And that if you do that, so the SCM is right here. I'm going to move my neck in a weird position so you can kind of see that, right? There's SCM right there. Attaches over here, goes up all the way. A lot of practitioners, like massage therapists, chiropractors, etc., will say that you can like grab onto this guy and like yank it out of the way of the jugular and the carotids, so that way you can basically do deep tissue on this muscle while being safe, and that is actually impossible. So as you can see here, this little guy, external carotid, I believe that is, runs directly over SCM. So it is impossible with that laying on top of SCM. And I wish I was trying to get it to where you could see this on camera on me. You can see it in real life, but just not on camera. You can visibly, if you're as pale as I am, you can visibly see this vein over your SCM. There's no way for me to pull up on SCM and yank it out of the way when that is laying over the top of it. It is impossible. So we can see that this cardiovascular structure is laying on top of everything, right? It is impossible to safely do anterior neck work at anything above like a 1 to 2 pressure on like a 1 to 5 scale, right? It is impossible. I actually know someone who served as an expert witness in a case where a massage therapist had been working the anterior neck in an unsafe way and had caused a carotid dissection, which gave the patient an ischemic stroke. I also personally know of a patient who went to a therapist local here in actually Rio Rancho, and they have been doing such intensive deep tissue work on her neck, like her anterior neck, that she actually became lightheaded and started to get dizzy and asked the therapist to stop. The therapist refused to stop, and she basically had to like sit up and end the session for her own safety. So those are just 2 quick instances of how dangerous it is to be working the anterior neck in an unsafe way. Now, how do you do this safely? So again, I use like basically a lymphatic type of pressure. So lymphatic work is super, super gentle, right? We're going to be like light. Like think of if you were applying lotion to your neck, that kind of type of pressure. So we can absolutely do lymphatic work safely here, or other types of techniques that use an extremely light pressure. Now, even with this extremely light pressure, you still have to be careful. That's not just like a blank check to like do whatever you want as long as you're using light pressure. No, you still need to be careful. You still need to not put direct pressure on that vein. So I need to know where that vein is, right? Which I can visibly see on people. So I need to avoid applying pressure directly over that. And then I also need to be aware of where the pulse is and then not apply pressure there as well, of course. So you can be very, very seriously harmed, and there are plenty of recorded instances of patients being very seriously harmed from dangerous anterior neck work. It is not a joke. It is not something just be flippant about. If a therapist starts using inappropriate pressure there, just tell them to stop if they won't stop in the session. It is for your own safety that you need to make sure that you are seeing a massage therapist who knows how to safely work this area, because it can absolutely cause strokes or other types of injuries. And for the love of God, please do not use a percussion or massage gun on the anterior neck. Oh my God. Also, another technique that I love to use on the anterior neck are like neuromuscular like stretching techniques, where it doesn't even involve me really touching the anterior neck at all. We can just do like different like resistance techniques and things like that to address whatever dysfunction is happening here without even touching it at all.